Hey everybody, it's Mike from the Mike Wagner Show, powered by Sonic Web Studios. Visit online at sonicwebstudios.com for all your needs. Looking at a professional website without breaking your budget? Sonic Web Studios is the answer. Sonic Web Studios offers fast, affordable custom web designs that blow the competition away. Call today, 1-800-303-3960. That's 1-800-303-3960, or email to support at sonicwebstudios.com. Mention the Mike Wagner Show, get 20% off your first project. Sonic Web Studios, take your image to the next level. Also, time to give an official shout out to our official sponsor of the Mike Wagner Show, international award-winning author Mia Mohsen Zia. If you love fast-paced mysteries, you'll love Missing by Mia Mohsen Zia, available on paperback and ebook on Amazon. Missing is fast-paced and intriguing with an unforgettable twist. It takes place in 4 countries, 2 strangers, and 1 target, where truth is an illusion and those you love be the first to go missing. It's available on paperback and ebook on Amazon. Missing by Mia Mohsen Zia has garnered great reviews and even loved and endorsed by Hollywood celebrities, including Joanna Cassidy, Forbes Riley, and many others. So grab your copy today before it goes missing by Mia Mohsen Zia, available on Amazon. Also, the Mike Wagner Show can be heard on the MikeWagnerShow.com. You can check our Facebook page at facebook.com/the Mike Wagner Show. You can download and listen on Facebook, SoundCloud, Spreaker, Spotify, and iHeartRadio. Also on Anchor FM, iTunes, Google Play, Amazon, Audible, and Apple. Coming soon to Podbean, Buzzsprout, Pandora, and TuneIn. Heard worldwide on Geo 7, Radio Public, Himalaya, and more. Take the Mike Wagner Show with you on any mobile device. Subscribe to the Mike Wagner Show on the YouTube channel, and follow the Mike Wagner Show on Instagram and Twitter today, and support the Mike Wagner Show on PayPal and Anchor FM/support. And also check out the Amazon.com merchandise store for the Mike Wagner Show merchandise, and for some cool treats and wonderful books by Mia Mohsen Zia. Check out Amazon.com/Mia Mohsen Zia. Do it today. We're here with a terrific doctor who is who is from the California area. So he is he's known for innovative medical therapies, including the stem cell research therapies, and he's been known as the stroke doctor, and he'll give a story about that, and uses stem cells to significantly heal patients, and we'll talk about those. And also grew up in northern Iowa, and he's also done a thing called product called Stemgetivity, and has a couple of books, which is Chlorella and also umbilical cord stem cell therapy. We'll talk about that. And live, ladies and gentlemen, from the Plus Studios in the beautiful library, ladies and gentlemen, the stroke doctor, the very talented Dr. David Steenblock. Dr. David, good morning, good afternoon, good evening. Thanks for joining us today.
Thank you for having me.
Well, it's great to have you on board too. And of course, you know, what you do is very amazing, Dr. David. So you specialize in personalized degenerative medicine, and you also have a website, and also you're known for innovative medical therapies involving stem cell research, and you also use those to significantly heal patients in such areas like ALS, dementia, Alzheimer's, chronic pain, stroke, traumatic brain injury, and a lot more. And you've been called the stroke doctor for a good reason. You also have a couple of books out as well. And before we get into all that, tell us how you first got started, Dr. David.
Sorry?
Tell us how you first got started.
On a farm in Iowa.
Okay.
And I was interested in one of our horses died, and I was 4 years old, and I insisted that I get to help the veterinarian do an autopsy on that horse, because I wanted to figure out why that horse moved just like the tractor moved, but one was flesh and blood, and one was hard metal and rubber. And so it was like my little 4-year-old mind says, they both are doing the same thing, and yet why is one flesh and blood and the other is not? And I wanted to figure out why it was. I didn't figure it out that day. And so.
Mm-hmm. And you seem to have a love for animals as well, too. And this has been going on for quite some time. And it was a possibility that being a veterinarian might have been in the works, too, since you helped out the horse?
No, I always wanted to be a human doctor and do research and on aging, basically, staying alive. Basically help myself, my family members, people that I love, keep them around. I guess fundamentally I'm greedy. I like when I like people, I want to keep them around and not have them, say.
When I heard you say greedy, I said to myself, you better go in the direction of saving lives, extending life for a long time. And
no, you can look at my bank account and tell I'm not greedy.
Well, send a little bit over. Maybe we can do some research later on. So we'll do that. And of course, too, that you also took it further as well, too. That you also went to school at Iowa State, and you got your degree, and you also went on to some other practices. I mean, you've been around the country just specializing in it.
Yeah, I've done a lot of things. University of Miami, University of Washington, hematology. I was in the first PhD program in gerontology in the world at the University of Miami. Had a master's in biochem, 4 years in pathology, Case Western Reserve and University of Oregon, Iowa State, as you mentioned. So a lot of places. I didn't do well in school. And let me tell you a quick story. How much time do we have?
Go ahead.
The point was that I didn't finish on the top of my class. In fact, I finished pretty much on the bottom of my class in medical school. And nobody ever likes to say something like that, but there was a reason. My medical school training was so bad, it was just worthless to go to. So I was supposed to go to this course or that course. And so instead I went over to the medical hospitals and worked with the medical doctors at the big university hospitals. And so I started my first year in clinic, instead of going to an outpatient clinic where they were seeing 3 patients a day, one with a sore throat, one with a cut on his finger, and one that needed a note to go back to school. And we were six students to take care of those 3 kids. And it's like, what am I doing here? Nothing. So I packed my bag and went over to Children's Hospital, talked to the medical director and said, do you mind if I join you? He said, fine. And for 3 months, I did nothing but stay at Children's Hospital, working with the interns, seeing just the most fantastic cases ever. So I got a tremendous education, but I got a D- on that course.
It sounds like that you would rather work at a hospital itself than go through classes and everything else. So
education means in medicine as much experience as you can get, as much training as you can get. And if you're not getting it where you are, and you can get by with going someplace else and getting it, and there other people are willing to show you and help you learn, I will take advantage of that anytime. And I did. So all those years, a couple of years, that's what I did. I went from one place to another and went to the very best places in our country to get training. I got really some great training, better than anybody else. And yet my grade was on the bottom because I was never showing up at where I was supposed to be.
Oh my goodness. And you said you got to encounter some fantastic situations, stories, and everything else. And you maybe can just share some of the situations you were in that it actually helped the patient greatly instead of your typical hospital treatment where they just they check you in, diagnose you, and rest, do tests, and then do whatever, and then you would just rest up more, write medication, send you home, and everything like that. And maybe just like a way of some fantastic stories, just instead of going through the whole usual hospital process, it's like, how'd you do it to speed up the process or even made it better?
Yeah, well, I'm always, I was in 4-H when I was a kid too. And our motto in 4-H was to make the best better. And that always stuck with me too. So I'm always trying, whatever comes along, I say, well, maybe I can make that better. So that's kind of like part of my being, if you will.
Mm-hmm.
Always trying to improve things.
Right. And also just another thing too, that, we covered some of the stem cell therapies and everything else. And besides, caring for the horse when you were younger, what were some of the, other reasons why you got so interested in stem cell therapies and, taking to the next level?
Well, like I said, I started off when I was early in life, I wanted to study aging and what we could do about it. And so when I finished my schooling, then I opened my office. And I thought that, I had a conflict with my PhD program in gerontology too, because they wanted me to study rats and not humans. And I wanted to study humans and what we could do about humans and what caused humans to get old, what caused people to get sick, and what can we do to stop all that? And that was what I was interested in. And so I approached it more from a holistic point of view. And so we had the first holistic medical clinic basically in the country back in 1978. And I had maybe about 30 people working with me. And it was quite the going business, but within 2 years, I found and discovered that you can have a holistic medical clinic with a whole variety of different caretakers working without tremendous supervision because they tend to think that they're doctors. And so pretty soon you have confusion and chaos when you're doing that kind of thing. And I had to stop that practice because the people that were working with me could not take orders and did not believe that they had to work under a doctor's office, a doctor's license. So I had to stop that and go back into regular medical practice. In any case, that idea of the holistic approach to everything stayed with me. And I've always been trying to look at every little nuance of a person's problem. So if you happen to have, for example, multiple sclerosis, I can rattle off all the different things that have been shown in the literature and in my experience, what causes MS or Parkinson's or Alzheimer's or ALS, or you name the disease basically in my head, and I'll just rattle off all kinds of things that need to be checked to see whether or not you have a problem with this or that. And if so, then we have to treat it. And so it finally comes down to, what do I specialize in? I specialize in taking out the bad and putting in the good.
And I think that pretty much sums up. We'll talk more about the stem cell therapies, your product called Stemgentivity, and also a couple of books and more. You listen to the Mike Wagner Show at the MikeWagnerShow.com, powered by Sonic Web Studios. Visit online at SonicWebStudios.com for all your needs. Look at a professional website without breaking your budget. Sonic Web Studios is the answer. Sonic Web Studios offers fast, affordable custom web designs that blow the competition away. Call today, 1-800-303-3960. That's 1-800-303-3960. Or email to support@sonicwebstudios.com. Mention the Mike Wagner Show, get 20% off your first project. Sonic Web Studios, take your image to the next level. Also, time to give a shout out to our official sponsor of the Mike Wagner Show, international award-winning author Mia Mosensia. If you love fast-paced mysteries, you love Missing by Mia Mosensia. Available on paperback and ebook on Amazon. Missing is fast-paced and intriguing with an unforgettable twist. Takes place in 4 countries, 2 strangers, and 1 target, where truth is an illusion and those you love be the first to go missing. It's available on paperback and ebook on Amazon. Missing by Mia Mosensia has garnered great reviews and even loved and endorsed by Hollywood celebrities, including Joanna Cassidy, Forbes Riley, and many others. So grab your copy today before it goes missing by Mia Mosensia, available on Amazon. Also, the Mike Wagner Show can be heard on the MikeWagnerShow.com. You can check our Facebook page at Facebook.com/The Mike Wagner Show. You can download and listen on Facebook, SoundCloud, Spreaker, Spotify, and iHeartRadio. Also on Anchor FM, iTunes, Google Play, Amazon, Audible, and Apple. Coming soon to Podbean, Buzzsprout, Pandora, and TuneIn. Heard worldwide on Geo 7, Radio Public, Himalaya, and more. Take the Mike Wagner Show on any mobile device. Subscribe to the Mike Wagner Show on the YouTube channel, and follow the Mike Wagner Show on Instagram and Twitter today, and support the Mike Wagner Show on PayPal at paypal.com/Mike Wagner voiceover. Also on Anchor FM/support. Also check out the merchandise for the Mike Wagner Show on Amazon.com/Mike Wagner Show. And for some cool treats and lots of goodies and also some great books, go to Amazon.com/Mia Mosensia and order today. We're here with the stroke doctor and author, Dr. David Steenblock, here on the Mike Wagner Show. And we talked about some of his background growing up in Northern Iowa, and also, how he got started. And of course, being the stroke doctor, and also with the stem cell therapies as well, too, that very innovative medical therapies. And also he has a website involving personalized degenerative medicine, and also talking about stem cell research, and maybe just about talk about some of the stem cells as well too, that the process starting on stem cells, and what that is and how can it be very therapeutic in helping with people, like you said, with ALS, also leukemia, stroke, traumatic brain injury, and more.
Could you ask me a question?
Okay, yeah. We were going to ask you as well too. Well, this is just me, by the way. So, okay. So maybe just take down and just put in a nutshell what the stem cell therapy research is, and how the process starts, and just take us through it one by one.
Okay. How about if you asked me a question about how did I get started with stroke? So let me give you that story because it's quite an interesting story.
Okay.
So back in about 1980, I began, even before that, I became interested in the use of hyperbaric oxygen. Under pressure. You put the person inside of a chamber, a hard metal chamber. There's usually windows you can see out, and you breathe the air inside, but the air inside is oxygen. and the oxygen goes into your body. And wherever there's lack of oxygen, that oxygen goes in and goes to those areas and provides those areas that don't have enough oxygen with oxygen, and they're able to revitalize themselves and to start regrowing and repairing and rehabilitating that tissue because of this daily treatment of hyperbaric oxygen. Well, so I was interested in doing that, and I had patients that we were working with them and trying this. You know, basically it was a new thing for me, and so I managed to have somebody buy me a chamber, and for Alzheimer's, we used it on this woman for Alzheimer's. It didn't do anything for her. In the meantime, I had a chamber now, and so I started treating people. But I didn't know really what I was doing because I just had training in how to use the hyperbaric, but not for what to use it for. And so somewhere about 1990, 91, I went to Amsterdam, and we had an international congress on hyperbaric oxygen. And a guy by the name of Richard Neubauer was there, and he showed videos of his patients that he had treated with hyperbaric oxygen. For example, he had one that was 3.5 years out after a stroke. He was still in a wheelchair, still not hardly able to talk. He was basically a mess, and yet he had spent around $300,000 on physical therapy. And so now, after that three years and $300,000 of physical therapy, he came to Dr. Neubauer. Dr. Neubauer put him through a 2-month program of hyperbaric oxygen every day, and so he showed us his video before, and then he said, and John, why don't you come out here? And John walks out on the stage and comes over and shakes his hand. So you're talking about a guy who is basically not able to function. He's still in a wheelchair, not able to talk, not able to use his arms. You know, he's paralyzed. And in 3 months of using hyperbaric oxygen, he's back to almost normal.
Wow.
So that really, really impressed me. I said, okay. So when I went home, within about a month or so, I had a patient that I had been dealing with, who was what shall I say, kind of a recalcitrant old sinner, and who liked to smoke and drink and eat fatty foods. And so she was 72, and she had severe heart disease, severe carotid artery disease. And so the doctors said they wanted to operate, give her, do a heart bypass, but they couldn't because the carotids were so filled up with plaque, she'd have a stroke. So, but they can operate on the carotids because then she'd have a heart attack. And so they said, forget it, we can't do anything. And so I told her that she needed to at least change her diet. So I changed her diet, and she said, forget it. I said, well, you're going to be back here. You're going to be either dead, have a heart attack, or a stroke, one of the three. I don't know which one. And so I didn't hear anything for about another 6 weeks. And sure enough, her daughter calls me from the local hospital, big hospital, and they're in the emergency room. They're admitting her to intensive care because she just had a massive stroke. She's basically not communicating. She can't talk. She's in a coma. And so the daughter says, what do I do? I said, well, now I have discovered the miracle, hyperbaric oxygen. I just went to this meeting.
Mm-hmm.
So I'm all loose. And so I said, well, call an ambulance and put her in an ambulance and sign her out against medical advice and bring her over to me. And she said, okay. And she did. She took her out of the hospital, brought her over in an ambulance. And here is this comatose woman, here's her mother. And I'm supposed to treat her and supposed to bring her back to life now.
HBO, so do your thing.
Yeah. So I said, well, let's do it. So we put her into our hyperbaric chamber, treated her for an hour, finished up, and absolutely nothing. She was still comatose. Nothing had happened. And I said, oh, shoot, I'm going to kill myself. I'm dead meat. They're going to take my license away and put me in jail. Because you can't take a person out of the hospital.
Mm-hmm. Right. Yeah.
Not do anything.
Work.
So what I had a big clinic at the time and had a lot of tools. So I had a lot of substances, chemicals, and different things like SOD, superoxide dismutase, and catalase, and DMSO, and EDTA, and magnesium, and a variety of things, mannitol. And I took all of that and threw it at her in an IV over 3 hours. And then I put her back in the chamber, did another hyperbaric chamber, and guess what? She got better.
Nice.
Yeah, I said, oh my God, it's working. So we did it over and over again. By 9 o'clock the next morning, she walked out of my clinic totally intact, back to normal.
Oh my goodness.
And I said, well, I have got a new career. It's treating stroke. And I changed my course and I decided to treat stroke from then on. So for the next 10, 15 years, I treated stroke of all types, chronic, acute, chronic, and I came up with all these different ways of doing it. And so we did the hyperbaric with regular physical therapy, speech therapy, and occupational therapy. Then we did acupuncture, we did biofeedback, and nutritional things and IV things. Well, tried all kinds of things to get things better. One thing that did work was, which is something that people who've had a stroke out there may want to hear about, and that is DHEA. I discovered that DHEA, dehydroepiandrosterone, in a dose of 200 milligrams a day over the 2 months of physical therapy that they're doing, really enhances the stroke recovery. So it's cheap. It's like $6, you know.
Really? $6? That's it? Wow.
Safe and simple. Well, I can tell you one case, for example. He was a 63, 64-year-old guy, sort of scrawny, skinny, maybe 5'8", and but he's got this right arm like this. It's about a year and a half, and he comes in and he came in on, I think it was on Friday, and I evaluated him and we talked about what we were going to do. And I said, well, you know, he was going to come back on Monday. I said, why don't you try this? And I gave him DHEA to take. So he took one that day, one Saturday, one Sunday, and I saw him Monday. And that arm, it was like this. Now, in 3 days, he was able to do this.
Nice.
And with DHEA only, it was amazing. That's an amazing kind of story. And so you see things like that, and you got to tell people, you know, now it's maybe not, it doesn't work for everybody, but now I've seen pretty good results with my Stemgevity for that kind of thing. So if you take my Stemgevity, which is a stem cell mobilizing agent, takes the stem cells out of your bone marrow, puts them into your blood, circulates them and go to the brain. If you do that and take the DHEA, then you should have even better results. So I've seen good that's going to cost you maybe $40 a month. You know, you can't beat that for price. And if you get any kind of result out of it, it's for $40. You know, what do you expect? You can spend
wow
on all kinds of supplements and you get nothing, right? You know, how many times have you bought all these vitamins that everybody touts you? They tell you, oh, this is the greatest thing in the world. And you buy it and it's nothing, right? I bought thousands of dollars of products like that. I didn't see anything, but the Stemgevity does work. And a lot of people just love it. In fact, I've had more compliments over my Stemgevity than I've had from all my patients in 50 years. That's about 50,000 people that I've seen. And I've got more letters of commendation from my Stemgevity than from me, you know, helping them. So anyway, so that's how I got started. So I did stroke for about 10 years there. And then it was about 1999, 98, people were always asking me, what else can we do? Because, you know, the Hyperbaric did good. And it always seemed, not always, but 90%, 95% of the patients got better. But then these are people like chronic stroke, 3 to 8 years out, 4 years out, 5 years out, that kind of thing. So after during that 1990, 99, something like that, people were asking, I was trying to find something else. And I started thinking and hearing about stem cells. And so I started looking for where I could get stem cells. And I found a source out of the Pasteur Institute. And so I managed to get some embryonic stem cells out of the Pasteur. So I didn't especially like to use them because of the fact that they're embryonic, but I did. We had great results, but there were some, you know, a lot of problems with that. So when I could, I switched over to umbilical cord, and so we got umbilical cord blood stem cells, and we started using those. And I started, first of all, there's nobody had done any studies at that time clinically, and so I would, you know, here I am trying to forge new territory, and so I said, well, I'd have to pick the cases that are the most easy to treat, the ones that are going to give us the best results. And so I thought, trying to figure it all out. Well, the ones that are the healthiest and the youngest are going to be the best. And so it turned out to be, and the white matter is the place where the stem cells like to go. So stem cells are attracted to white matter damage, which is in your brain. And so cerebral palsy is a white matter disease, white matter damage of children. And so the children who are healthy, they have lots of growth factors, and they have just damage to the white matter. And I said, well, if we give stem cells to them, they're going to sort of go right to the white matter, and we're going to get some really good results. And that's exactly what happened. And so we started having really good results with cerebral palsy, and we continue to have the same really good results. We did a review of, I don't know, the last 100 cases, and it was about 80% of the patients had success. Now, that means that there's still 20% of the people that fail stem cells, and that occurs with pretty much everything else. And so I've been working on why that is, and I'm not so sure I have found it, but I can tell you quickly what it looks like, and that is that they're in kidney failure, stem cells do not work either. So you can give lots of stem cells, you can give them intravenously, intraarterially, you can give them right into the renal artery, through a catheter, not much. And, so I thought, why is that? I hate to figure. So I thought that, and so I came up with the idea that there are kidney poisons, obviously, that's why you use dialysis, right? And so these people always have to have dialysis because they're toxic, they have uremic toxins. And so it turns out that there's about 10 different small molecular weight uremic toxins that cause toxicity to the body and inhibit the stem cells from working.
Wow.
Now, those toxins come from your gut, and it happens in you and me too. Mm-hmm. So just we don't have kidney failure doesn't mean we don't have those toxins. You see, so normally our kidney is trying to clean it out, but if we happen to have a bunch of bacteria that are making a lot of those, then your kidney can't take them out as much. And when we give you stem cells, those small molecular weight uremic toxins are poisoning you, so your stem cells don't work. So we're having a problem with our small molecular weight uremic toxins that are preventing 100% of the patients from getting well. So what we're doing now is we're cleaning out the body as much as we can. So I take out the toxins as much as I can. I've got some new what are called binders and whatnot that I give to the person. And then we try to kill all the bacteria and whatnot in the gut too. We do that for anywhere from a couple weeks to a week. When they come here, if they're really serious, we give IV antibiotics and antifungals and whatnot, and oral binders. And then we also, the albumin in your blood, very interesting. The albumin is your number one protein circulating in your blood, right? It's the number one sponge for toxins that you have in your body.
Wow.
Everybody talks about the liver. Well, the liver is not a sponge, it's a processor and detoxifier, but the albumin is a sponge and sucks up the poison that come from your gut. So if you have gut poisons, gets into your blood, the albumin sucks it up, and guess what? Now it's circulating. You got all this circulating toxins in your albumin. Now those endotoxins, these small molecular weight uremic toxins, cause damage to the capillaries and the endothelium. So the endothelium, the inner lining of your blood vessels, start to leak. And if you happen to have an area like in your brain that's leaky like that, then that albumin with the poisons get in there and it'll cause things like Alzheimer's or Parkinson's, or MS. Now, another thing about the gut bacteria, there's a type of bacteria called Bacteroides fragilis. It's supposed to be it's very common. I've treated about 100 plus amyotrophic lateral sclerosis patients, and absolutely everyone had this particular bug in their gut. But when you get the laboratory report back, it says it's normal. It's what's called a commensal. You don't worry about it. I did this for years. I said, well, why should I worry about it? I got other things to think about, right? But finally I said, well, maybe I should take a look at this sucker. And son of a gun, you start looking at it, it turns out that Bacteroides fragilis is a unique little bug. It does have toxins. And one of the ways it creates toxicity is that the outer cell membrane has a thing called endotoxins or lipopolysaccharides, and it's a special kind of lipopolysaccharide. Now, lipopolysaccharides, when they get into your blood, cause all kinds of inflammation because arthritis, and when you're just cruising along like in your normal life and something pops up on your skin, it's red and sore and starts to itch and painful, that's probably an endotoxin coming from your gut, because why would it pop up and just here in my chest or there, where?
Yes, that's common a lot too. I heard there, and very good points. I like them.
Yeah, so the point of it is, if that's happening, then you have to start thinking about your gut. You have a leaky gut. And so leaky gut allows all this crap to get into your system, and now goes to your albumin. And wherever there is any inflammation, the white blood cells, the neutrophils, go there and release what is called VEGF. And the VEGF, which is vascular endothelial growth factor, is trying to help make blood vessels. But to do that, it opens up the tissues. And so it actually creates the leaky gut or leaky blood-brain barrier or leaky cerebrospinal fluid barrier. So if you have a chronic, slightly elevated neutrophil neutrophilia, or in other words, a little excess neutrophils in your blood, you probably have a chronic infection that is causing some of these problems that you're having. So it's fascinating. And so by taking all this stuff out, we get rid of the toxins. We take the albumin actually out of your body, we draw the blood out and suck out the blood, take out the albumin that's poison and throw it away and put back fresh albumin. So now we have a fresh sponge to sponge up all the poisons. We do that for 3 or 4 days before you have your stem cells, so that we've got you as clean and pristine as possible, so that we have a week of you're having a body that's as close to being a newborn baby as we can.
Wow, I learned a lot from you. And just a couple of things here before we talk about your books. And there's a lot of remedies out there, how to clean out your gut and to get rid of all this and that. And what is your recommendation for cleaning out someone's gut? What is your recommendation?
Well, no sugar, a lot of fiber. So you want to oatmeal is good for breakfast. Brussels sprouts, broccoli, the cauliflowers and those kind of things. Those are anti-inflammatory as well. So you want to have as much fiber. Psyllium seed, plain psyllium seed is good. One of the tricks, is about HDL, high density lipoprotein, and COVID. People who have low HDLs, like men, are more prone to have serious side effects from COVID.
Really?
And who have high HDLs don't have. And the reason for that is because HDL is a very powerful antioxidant. And so it helps prevent the COVID from causing free radical damage, etc. So how are you going to change you around or me around? Turns out, of all things, extra virgin olive oil.
Oh.
Olive oil, if you take like a shot glass, 30 ml in the morning and at night, it raises your HDL, and that protects you from having the side effects of the COVID.
Wow.
Plus, it helps soothe and coat your intestinal tract. We use that, I knew about it many years ago in children who have chronic diarrhea, kids with, the scours basically in calves. We had a thing called scours, and you could probably treat them too, but kids get diarrhea oftentimes. So it turned out that the pediatricians thought that the reason why that olive oil was working for helping stop this diarrhea was because it helps strengthen and thicken the gut wall. Because if you're made like me, you have thin membranes, and when you have thin membranes, you're very sensitive. And then you have a guy who's stout and short and thick, and he's got thick membranes. You can give anything to him, and he just trucks along right through it. His nails, he'll live to be 150 and smoke and drink, and who cares? Me, I get one whiff of it and I get sick. Why? Because my membranes are thin. So anyway, the olive oil helps thicken your membranes, protects you from all that junk. So what else can you do? Well, you can add to that the psyllium seed too. So now you got, when you mix it up. So it's a fat. And so you have fat soluble vitamins. So your vitamin D, your vitamin A, your vitamin K, your E, your fish oil. You can put all of that in that same olive oil and put a blender. So you blend it all together. Now you don't have to take those stupid pills all the time. And when you blend it together with the olive oil, it makes it into what are called liposomes, and you get a much better absorption of all those things too.
Wow.
So, now you have a lot of yeast or a lot of bugs that you're pretty sure you got, and black seed oil. Black seed oil, black cumin, you can take a tablespoon of that and pour that right in there and mix that. Now you got an antifungal, antibacterial, anti-neuroinflammatory. It helps with shutting down inflammation in your nervous system. So it's an anti-inflammatory too. So, and there's all kinds of things written about those things too. So what else? Now you can add a little bit of cinnamon. That's an antibacterial. Just a pinch or two of cinnamon. Okay, that's it. So you got that. So you can just keep thinking, what else can I do to so like if you have lupus, systemic lupus erythematosus, that's a leaky gut problem. Okay, so all those people have leaky guts, and they all have bacteroides, and they have all this junk that's, bad bugs. I forgot one thing about that bacteroides is that it binds that lipopolysaccharide outer shell, binds with aluminum, and takes the aluminum out of your diet and takes it into your blood and carries it to wherever there's inflammation, like in your cord. It goes into your cord, and you get MS from it. You measure and look at the aluminum in multiple sclerosis patients. They have lots of aluminum. in their stomach.
Wow.
And guess what? ALS patients also do. So, and so you have all these things you start with, and it's all related, and I always used to say, and I'll still say it, the devil's in the details. And if you don't pay attention to the details, you just lose. And so people come, like one case I had once was, she had seen 30 doctors for, about, I don't know how many years, quite a few years. And she'd been going, well, I'm just always sick, never could work, always miserable. And I had been studying at that time, that was back in 1983, 84, and I'd been studying candida, yeast. And everybody's, it was still being said that it was all quackery. Nobody believed in any of it, especially the doctors. And I didn't either. But I had her, and I looked it over, and I'd been studying. I said, well, it's not going to hurt. All right, what the hell? And I put her on antifungals, and within 2 weeks, she was a new person. She was back to normal, and she hadn't been that way for like 10 years. She couldn't thank me enough. And that changed my whole personality, not personality, but my perspective.
Perspective. Yes, I was just going to say. Oh, wow.
It probably changed my personality too. So anyway, I started doing more and more candida, evaluating candida. And now, I was the one that came up with a lot of these, like ALS now, all the patients. When I started, nobody ever thought anything about the gut. And I was the one that first said, there's probably something with the gut. Started looking, and sure enough, found that they did have yeast in all of this. And now it's actually been proven by autopsy that they all have yeast in their brain, spinal cord. But I was one of the first ever to find that and come up with that. So anyway, so here I am in 2000, and people are asking, what else can we do? And I started working on stem cells. So we started doing stem cells in Mexico with cerebral palsy, getting great results. By 2006, I came across how to do with the bone marrows and started doing bone marrows. And so we started doing bone marrows and umbilical cord. So I learned a lot about how a person's bone marrow is. When you're doing a lot of people and evaluating and seeing how they do with their bone marrow, you can start to see what works and what doesn't. And so if you're under 50 and active, generally you didn't have any chronic infections in your system, you had really good results. I mean, sometimes amazing. I had one guy, one 18-year-old once, who was a basketball player, tore his shoulder and was told it was going to be 3 months of not working and not doing anything with it. I took a slug of bone marrow out, just the raw bone marrow, shot it into his arm, and he was back playing in the full faculty game 1 week later. And
wow.
So, it's like, how could that be? The father was a doctor, and he called me up and said, man, I can't believe it. It's a miracle. And so you do see sometimes miracles. Now, unfortunately, you don't see them all the time. So you have to be real honest about everything with everybody. People come in, and if you drink alcohol, it probably won't work. So I can tell you, alcohol, if you're taking stem cells or trying to have repair of your body, alcohol kills all the new blood vessels growing. Now, also, if you get involved with a car accident, really smash your body up, or fall on your head, if you're trying to, see if you got a stroke. If you fall on your head, about anywhere from 5 days, a week to 3 weeks out. If you fall and hurt yourself and smash yourself up, whatever progress you were getting, all the money you spent on stem cells usually is gone, because the blood vessels that are very fragile, that the stem cells are growing, are so fragile that when you fall, it breaks them, and they can't seem to fit themselves back together again, because it just doesn't work. So you want to be very careful. Another thing is infections. You don't want to get infected. So if you get a cold, like a COVID or something, that pretty well messes you up. So talking about COVID, I've been working on COVID. Some of my stroke patients some patients with stroke have been coming because of the COVID. So they got the COVID, then they got a stroke, and they now come to me. So now I'm getting to see what's happening there. It turns out that it's not been reported, but what I'm seeing is what are called white thrombi, little white blood clots. They're white because they're made out of platelets. And these platelets are, a platelet that comes onto a glass surface becomes activated. And so here's a round platelet, comes and touches that and then flattens out, tries to stop the blood from escaping. So it tries to stop the clotting. So that's part of activation. It opens itself up and spreads. Well, in this case, for some reason, instead of doing that, it just completely blows apart.
Wow.
So it looks like, you see these pictures of the coronavirus. Well, this is what a platelet looks like. And but those little spicules that they talk about, the spike, are even bigger. So these spikes are sticking stuff, and those spikes when they reach out and touch something else like another platelet, they glom onto each other and they fuse. Now you have one fuse platelet to another, to another, to another, to another. And you know, the literature says they don't say, they just say it's a blood clot. They don't say it's white, but it is white. And so now we can look at these platelets and try to figure out what we can do to stop it. And that's what I'm right now currently doing, is trying to figure out that little niche of how to stop that whole thing. So that's my research project, because I got to do something here.
That is so amazing. I'm learning a lot from you. And not only do all that great work, you also have a couple of books. We'll get to that in just 1 minute. You listen to the Mike Wagner Show at the MikeWagnerShow.com, powered by Sonic Web Studios. Visit online at SonicWebStudios.com for all your needs. Also brought to you by our official sponsor, the Mike Wagner Show, international award-winning author Mia Mosensia of Missing, available on paperback and ebook on Amazon. We'll be back with the stroke doctor, Dr. David Steenblock, after this time out. We're back with author Dr. David Steenblock, and also the stroke doctor on the Mike Wagner Show. You have a couple of books out called Chlorella, the National Medicinal Algae, and also Umbilical Cord Stem Cell Therapy. You can quickly tell us about those two books you wrote.
Yeah, well, Chlorella is an interesting product. It's another detox type of thing. It stimulates your immune system and helps. You remember how about the leaky gut? So if you take that along with your meals, they're usually tablets, but they come in capsules. So you can take the one brand that I was using is YSK International Sun Chlorella. And so if you take that with your pill, you take that with your meals, that helps block those endotoxins from getting in. Now, if you take Chlorella and my Stemgevity together, then you have a combo benefit. So they both help prevent these endotoxins that are binding onto the aluminum and other things and getting into your system and causing inflammation. You know, yeah, if you have this kind of leaky gut, you'll get oftentimes chronic fatigue and aches and pains, like joint aches and pains. And so you can hardly get out of bed, you're tired all the time, that kind of thing. So if you start taking those two together, you should start seeing improvement within maybe 3 days. You should, and if you take DHEA, now that's a great combo.
Yes.
And the Chlorella, you will feel better.
And that's so amazing as well, too. And where can we find your books at? And how can people get a hold of you to, to say if you have a problem, need something fixed? And where can we find your books? And how can people get a hold of you?
Well, my website is strokedoctor.com, strokedoctor.com, just like it sounds, STROKEDOCTOR. My phone number is 949-367, 367-8870. Sorry, I got so many phone numbers. 367-8870. And just give us a jingle. I'm happy to answer your questions. You can give you for like 5 minutes, just a quick, yeah, you should do this and this and this. I won't charge you for that. But then if you have, a stack of records this high and it take me a day to go through, we're going to have to charge you. So,
well, then just come on in and bring your papers and everything else. So that's what you got.
Yeah, so let me just quickly tell you what we have here. I don't know if you're going to get a picture of what's going on, but here I've got about 16,000 square feet, and it's just my office. I've got a library of 5,000 square feet, the largest medical library in the world for a private doctor. I've got over 1 million scientific papers, over 60,000 books, and they're expensive books. And so I can go to my library and sort out whatever if I don't know or understand. And I was just there looking up articles on what I'm going to do with this, making a product for the COVID. And so I have all this data. And so I'm just doing it now. But here in my office, and then I have a stem cell lab. So I'm one of the only doctors in the country that has his own stem cell lab. And so I have my own flow cytometer, my own centrifuges, microscopes, hoods, isolation rooms, that kind of thing, lab techs. And so here in this office, which is the clinic, I have hyperbaric oxygen, 2 chambers. I've got external counterpulsation, which is a method to increase circulation throughout your body, and especially your heart. And then we have a special room that I've invented called a stem cell repair, stem cell regeneration kind of room. Basically, it's a room where without any needles, we treat your body with electromechanical things like magnetic therapy to your hips and legs, electric therapies to your legs, and also intermittent hypoxia, which is high altitude training. And so, and then we have, well, so all of those causes release of stem cells into the blood. And then we have red lights that are 630 nanometers over your body. So you have just your shorts on or your shorts and bra. And then these red lights flood your body, and that stimulates the stem cells that are coming out of your bone marrow and makes them proliferate. So we have a combination of things. And so that can be very good. So we try to use that with anybody who comes in for stem cells, just an IV, we'll try to do that. So it's for that, you get another boost as compared to everybody else's stem cells in the country. So, and we use a different kind of stem cell than everybody else too.
Mm-hmm. And that is very amazing as well too. And also you also went over what can you expect from you in 2021 and beyond. And of course, looking for ways, to fight the COVID. And, just lastly with Dr. David Steenblock, the stroke doctor here on the Mike Wagner Show, who do you consider biggest influence in your career?
My mother. My mother. I love my mother, and I wanted to keep her around. But then, when she got to be old and she had a stroke, I actually brought her out to my office, and there's a story. So she comes in my office, basically not functioning very well. She's paralyzed, hardly can talk. And so she has to sleep sitting up. She can't lay down. And so there's only me. So I'm the caretaker at this point, just me and my mother. And I haven't seen her for, been working with her for a long time. And so she starts doing what is called chain stoking.
Mm-hmm. Mm.
And so that night that she came, she was doing that. And I had to help her go to the bathroom and pull down her pants and pull her pants up. Oh my God, I don't think I can do this because I got to practice to take care of. And I was a busy guy. And if I was having to be up all night, it was going to kill me trying to take care of her. And so the next morning I was motivated to get her well. So I took her to the office and I treated her quite well that day.
There you go. I mean, that's what moms are there for, and they love you, and she'll love you for even more. So yes.
So I treated her very well. And that night she stopped chain stoking and she could pull up her pants and take her pants down and she could go to the bathroom by herself.
Oh, that's so amazing. and
that's a true story.
And of course, on Mother's Day too, don't forget that. So happy Mother's Day. We got you better. So, and what's the best advice you can give to anybody at this point, Dr. David?
Pay attention to the details, and don't listen to the lies and misinformation that is constantly being put out. Today, I got a video from a friend of mine. He says, "What do you think about this video?" And it has some guy saying, "You can't believe it, but when they're doing these tests for COVID, that probe they're sticking up there, they're not doing a test. They're putting nanoparticles in their robots that are going to control your mind." And he thought it was real. I mean, if you start believing that stuff, you're lost, man, because that's absolutely crazy. First of all, who would want to do that? Number one, to you. Who cares? Why would we care about turning you into a robot? We can't get you to do anything anyway. When you're not a robot, why don't you go do this? And Mike says, "I'm not doing it."
And of course, I'm sure there's stem cells that can get rid of nanobots too. That's next on your bucket list. So.
Yeah, well, that's what they're saying, but that's not going to happen. I can tell you for a fact.
Right, exactly.
So there's so much junk out there that you just have to be careful about listening to it, because if you don't know and are not willing to learn and look it up, then you're lost. Because when I tell everybody, just look it up, go to Google and check it out. And if you do that, you'll get at least the facts from Google. They're pretty good at keeping it straight and narrow. And that way you can know what's going on, what's true. But if you don't, and you just listen to people talk and see these videos, you're just going to just believe all kinds of stuff that's not true. And you wind up trying to get Trump reelected.
Mm-hmm. And of course, if you want the real truth, just check out Dr. David Steenblock, and of course, check out the website and everything else. And Dr. David, I'd like to give you a big thank you for your time. You've been absolutely fantastic. Learned a lot from you, by the way. Looking forward to having you again soon. And keep us up to date. Once again, tell us about your upcoming projects, what's your website, and how do people contact you? Where can people just simply check you out, especially your books?
Thank you very much.
And where can they check you out? Yeah. What's your website once again?
Oh, strokedoctor.com.
Strokedoctor.com. So make sure you guys go to it. Again, Dr. David Steenblock, a very big thank you for your time. You've been absolutely great. Looking forward to having you again soon. Do us a favor, keep us up to date. Love you back on in 2021 and beyond. And don't forget to keep in touch as well. You've been absolutely fantastic. Learned a lot from you.
Thank you very much. Thanks for having me.